Hello, good morning, everyone, and a very, very warm welcome to Nordregio, Nordic Welfare Center, and today's webinar. My name is Åsa Ström Hildestrand, and I'm Head of Communications here at Nordregio, and I will be the host of today's webinar about how can welfare institutes collaborate for regional development. And we are here to present a new study on welfare institutes in sparsely populated areas. We are going to start with the presentation of a new report on this topic, and then hear different perspectives and comments on the report from Australia, from Iceland, and from northern Sweden, and also have time for a little bit of a discussion towards the end. So the webinar will run until 11 o'clock. And of course, as always, we like to hear from you as well. So please say hello in the chat, share any links if you work with this topic in any way, have any new reports coming out, or represent a similar institute in a remote or sparsely populated area somewhere here in the Nordics or beyond, somewhere else in the world. So please join the chat. You also post your questions in the chat, of course, so we can pick them up during the discussion. And as always, we will share a recording of this webinar and together with the presentations slides after the webinar. Right, I think I shouldn't take any more time right now, but introduce our first speaker, and it's my colleague Johanna Jokinen. She's Senior Research Fellow here at Nordregio, and you are the author of this report. You've looked closely into the WIiSPAs, where they are, and the potential for collaboration and networks between WIiSPAs, welfare institutes in sparsely populated areas. Very welcome, Johanna Jokinen.
Thank you. As it was told by Åsa, so my name is Johanna Jokinen, and I work as a Senior Research Fellow in GIS at Nordregio. This working paper that I will be presenting is based on a project called Welfare Institutes in Sparsely Populated Areas. That was, and the project was coordinated by Bengt Andersson at the Nordic Welfare Center and funded by the Nordic Council of Ministers. This concept of welfare institutes in sparsely populated areas has been used in recent years in connection to the project called Healthcare and Care with Distance Spanning Technologies that has been managed by the Nordic Welfare Center and the Center for Rural Medicine. And now there is also a continuation of this project that is called Integrated Healthcare and Care through Distance Spanning Solutions. And that project started for 1 year ago. Underpinning the concept of WIiSPA is the belief that the well-functioning welfare sector with effective and accessible services is a prerequisite for regional growth across different sectors in sparsely populated areas. Since rural regions in the Nordics often face similar challenges, a pan-Nordic WIiSPA network would facilitate the implementation of results based on Nordic welfare and regional development projects. While the concept of WIiSPA has existed for a few years now, there has been no clear definition of the term. And therefore, the purpose of the working paper was to clarify and determine what components, stakeholders, and visions could constitute a WIiSPA. It also aimed to identify existing and potential WIiSPA clusters in the Nordic countries and beyond. And it also provides some recommendations on how a network of identified WIiSPA clusters could be developed. The results of the working paper are based on desk research, short interviews, and roundtable discussions with local stakeholders and researchers. And I will also tell a little bit of background for the report. Early research on rural health has often focused on empirical examples from countries with extensive remote areas and specific indigenous populations, such as Australia and Canada. Rural health research and policy have primarily addressed the challenges surrounding rural citizens' access to healthcare services, combined with recruitment difficulties and the provision of education and training in sparsely populated areas. More recent studies have also recognized that rural residents tend to exhibit more unhealthy risk behaviors that often correlate with certain societal factors, such as lower levels of income or educational attainment in rural regions. Increasing digitalization of health and social care services is seen as a lucrative and cost-effective solution to close these inequality gaps in health between rural and urban areas. So what is a WIiSPA? Based on very initial discussions, a WIiSPA is understood as a research and development institution that aims to bridge the gap between the innovation priorities of remote communities and the R&D infrastructure that is often based in urban areas. While the WIiSPA concept is based on several examples of rural innovation laboratories within the field of health and medicine, the WIiSPA should employ a cross-sectoral approach that also includes other welfare sectors. And potential WIiSPA stakeholders include local, regional, and national government, entrepreneurs and local businesses, private and public organizations engaged in providing services, universities and research institutions, non-governmental organizations, rural residents, including indigenous populations, and also decision makers. It is suggested, therefore, in the working paper that the WIiSPA can be understood as a local R&D institution that assess and promote local research and development priorities, facilitate training, skills, and supply and recruitment in sparsely populated areas, for instance, by providing examples of rural practice and the role of rural professionals, and improve local R&D capacity. Then in the working paper, we also discuss the role of WIiSPAs. Through networking with relevant stakeholders and other WIiSPA actors, the WIiSPAs are able to promote innovation, new knowledge, and quality of life in sparsely populated areas, with a particular focus on preventive measures and health-promoting lifestyles. Developing research questions from a rural point of view is also essential, having a primary focus on rural populations and their needs, with a particular focus on vulnerable populations in rural areas. The WIiSPAs would also function as a basis for sustainability and community empowerment in sparsely populated areas, further strengthening and reinforcing the higher education sectors and labor markets in those communities. In addition, the WIiSPAs could function as ambassadors for sparsely populated areas by providing relevant narratives and showcasing sites for innovation that may inspire students and professionals to choose rural careers. The main tasks and areas of responsibility of WIiSPAs were identified at different levels. On a local level, the WIiSPAs provide an excellent setting for participatory action research, since they allow decentralized research activities and development initiatives that are as immediate to the local populations as possible. At the Nordic level, the WIiSPAs are intended as a network enabling mutual support and dialogue around the experiences of local initiatives, which in turn would accelerate the implementation of innovative practices across the Nordic region. At international level, WIiSPA networking beyond the Nordic region is also relevant, since progressing R&D questions through international partnerships is often very beneficial. The working paper describes several examples of existing WIiSPA actors in the Nordic region and beyond. While these institutions should not be understood as fully developed WIiSPAs, future WIiSPAs could be created around the already existing functions of these organizations. Mostly, the visions and goals of these clusters correspond very well with the defined tasks of a WIiSPA. And I will now go through some of these examples by focusing on the goals and visions. First, the Center for Rural Medicine in Storuman in Sweden is a unit focusing on R&D and education in the field of healthcare and social care, access to care services in SPAs by using distance planning technologies, and the health of the Sami people. The Norwegian National Center of Rural Medicine in Tromsø aims to narrow the gap between rural medical practice and academia, facilitate education and networking among rural healthcare professionals, and improve recruitment and the stability and quality of rural health services. The Iceland Health and Welfare Technology Cluster aims to improve the quality of life across 12 municipalities with an aging population in northern Iceland, with a focus on the implementation of health and welfare services by using distance planning technologies. And the Center of Expertise on Social Welfare in northern Finland aims to develop social welfare services, ensure a comprehensive link between education and practical work, perform research and testing, among other things. The working paper also includes several examples of WIiSPA clusters that are located outside the Nordic region. For instance, Rural Health and Care Wales aims to promote and develop cooperation on research on rural health and well-being, improve training, recruitment and retention, and it aims to become an internationally recognized example on issues of rural health and well-being. The Scottish Rural Health Partnership aims to foster collaboration and share knowledge between healthcare providers, educational institutes, academia, businesses, and local communities in the field of rural health and R&D initiatives. The Mid-North Knowledge Partnership in Australia aims to facilitate collaboration between different stakeholders in relation to service provision in remote communities in South Australia, both in the medical field and also other welfare sectors. And the Gardner Institute for Rural Reach and Innovation by the Sea in Canada aims to undertake research initiatives that improve local community health and support the field of medical research globally. And here are some concluding remarks from the working paper. Based on the results of the study, a WIiSPA can be understood as a locally driven, cross-sectoral R&D institution that is located in a rural community and that is working closely with an academic institutions. WIiSPAs can be organized in slightly different ways in different places, and they can have specific focus areas depending on the local context. While creation of the WIiSPA network should be a Nordic initiative that facilitates exchange of experiences and contributes to regional development in the Nordic sparsely populated areas, it could be beneficial to also include WIiSPA clusters located outside the Nordic region in the network. And features of the WIiSPA network could include, for instance, a regular newsletter, a yearly WIiSPA forum, and an academic journal that publishes WIiSPA relevant research. Thank you.
Thank you so much, Johanna. Thank you. This was a very thorough mapping, I think, and overview. And clearly there are several interesting WIiSPAs around in the Nordic region and beyond. And we'll meet some of them today. I just thought before we travel to Australia to hear from them, was it anything that sort of surprised you in this when you did the mapping in terms of the work that they do? Or what do you think about the potential of developing these WIiSPAs? Do you have any specific thoughts on that? You've done the report.
Sorry.
You mean to develop this network and the learning? Did you also see that there is an engagement and willingness to collaborate? For example, do you think these different WIiSPAs see the potential here of collaborating to learn more?
Yes, I think quite many of them of these actors that we have identified are really focusing on collaboration at different levels. So yes, I think there is a huge potential to
and you see that
on this work.
And you think they have many similar challenges as well, or is it different situation in the different countries in general?
It may be slightly different situation depending on the local context, because there are also huge variation between different rural regions in the Nordic countries and beyond. But I think the main challenges are quite similar in many places.
So lots of potential to learn. Great. Thank you again, Johanna. And let's see if we can connect with Australia. And you'll come back later for the discussion. Do we have Heidi Hodge with us here? Yes. Hi, Heidi. Welcome to Nordregio and Nordic Welfare Centre. You are active. You're a PhD candidate at the Central Queensland University in Australia. And we're really looking forward to hearing your perspective, comments from what you just heard, but also tell us a little bit about your reality and the challenges you see and the potential developing WIiSPAs in Australia. So we should share your presentation now, I think.
Thank you, Åsa. And thank you also for having me and for everybody that's joining us online. Well, it's my evening, but your morning. It's a huge privilege for me to be speaking with you all today. So thank you for having me. And I'll just wait for our slides to come up. But while I'm doing that, thank you. While I'm doing that, I'd like to acknowledge that today I'm speaking, joining you from the Nordregio country, and I'd like to acknowledge the traditional owners of the traditional custodians of these lands and pay my respects to elders past, present and emerging. I'd also like to especially thank Professor Dean Carson, who many of you will know. Dean helped establish the Mid-North Knowledge Partnership in 2012, and this work has very much continued through collaborations and continued to build on the good work that he had done and continues to do. So I wanted to thank Dean and acknowledge his efforts in this as well. As also just mentioned, I'm a PhD candidate. I'm looking at rural innovation labs after having also been involved with the Mid-North Knowledge Partnership as an employee from the start. I realised at the time that what we were doing, certainly for us in Australia, wasn't typical. There weren't very many other comparable cases out there. And I just found that really interesting, and suddenly that somehow turned into a PhD. Dean connected Johanna and myself in the last few months, recognising that we're looking at similar things, and connected us to see how we might be able to exchange our collective knowledge. And I'd also like to congratulate Johanna on the production of the report. I think it's really brings me great joy to see the development that's happening with this, with the WIiSPA network and the WIiSPA ideas, and again, building on the work that's been done over the last few years. And I just think that's really exciting. Next slide, please. So you might wonder what a South Australian is doing playing in the Nordics. I did think it was rather curious to start with as well when we started speaking, particularly with Peter, and talked about bringing the Swedes over here and us joining yourselves over there. And I soon realised that actually we have an awful lot in common. Many of the issues that Johanna raised about the aspects of rural challenges and around particularly service provision are similar to what we face over here as well. So with this map, the dark green areas are basically the higher concentrations of sheep in Australia, and that little red star is roughly where we are here in South Australia. So effectively, if you swap reindeer for sheep, it kind of gives you a bit of an idea of the context that we're operating in. Borough near where I am is similar in size and services to Storuman. It's about the same distance to the next nearest larger town as Storuman is to Lycksele, and our next nearest metropolitan city is similar in size and distance as it is to Umeå. So hopefully that gives you a bit of an idea of the context that we're operating in as well. Next slide, please. In the interest of time, I won't spend too long sharing much detail about what we do. It is a pet passion of mine, so it'll chew up a lot of time. But effectively, as I mentioned, we emerged in 2012 or thereabouts. Over the time that's lapsed since then, we've undergone several change markers and responded to those and evolved with the kinds of activities that we're doing. Our case here in South Australia is slightly different to GMC in that we're we started off university-led, whereas it's my sense with GMC that's more of a community-led approach, and we've ended up as a hybrid of sorts. So we've been almost entirely reliant upon the university to support our endeavours over the years, and I'll talk about the implications for that in a minute as well. Our initial focus was through a rural medical school lens. They've had been hosting us, and the types of students and researchers we tended to attract were our postgraduate medical students who were training to be general practitioners for the most part, in the hope that by us giving some additional exposure, they might consider becoming rural GPs and gaining some rural research skills along the way as well. So we set out with some guiding principles that we established early. We didn't know if this was going to actually work, to be frank. We set out as a 12-month pilot project. As I say, that was in 2012, and we long outlived that pilot framework. So we, again, didn't know what that was going to look like, but we operated under these principles. And even to this day, these principles have become even more important than ever, I think, and really not changed too much. So we didn't set out to be a teaching campus. We set out to be research oriented and give people the opportunity to grow those skills. For people like myself who were based locally, didn't have a background in research, other professionals, and also attract other students from elsewhere. We're very much community engaged, and this sense of local and beyond place, again, Johanna picked up on it earlier, and the report emphasises it, and I'll say it more than once now as well, this sense that we're undertaking projects and activities and programs that are interesting and important to our community, our local community geographically, but also they're interesting to the international research community also, and contribute something and are of interest. And being able to combine those and produce scholarly outcomes has been a really important way of being able to capture our stories and provide an evidence base for what life is like here and what services are needed and how we can go about developing our workforces, and many of the other things that Johanna has previously mentioned also. Next slide, please. Thank you. So I mentioned the evolution, and again, I'll just briefly gloss over this, but we needed to be responsive to these external influences. Because we were university-led, it meant that we're very vulnerable to their changes in priorities, both for funding and research priorities also. And the activities that we piloted in the early days of the Mid-North Knowledge Partnership were then formalised some years on into what became known as the Free Range Program. And this was, from memory, around the same time that the idea of the WIiSPA network emerged as part of that also. The Free Range Program provides small bursaries for students and visiting researchers to be able to attend one or two free range short bursts of activities in the host country, whether that be Australia, Sweden, Austria or Canada. Iceland, I think, might have been involved as well. It's now hosted by Carleton University in Canada, but this photo that I took, the tiny little figures you can see are the first free range scholars standing on frozen Lake Storuman under the Northern Lights, which I can tell you was a fairly good moment to see this all come to life from small ideas. Next slide, please. So we kind of found it challenging to find the right kinds of terminology as well to describe what it was that we were doing. And we have used the term rural innovation labs, which is typically used specifically within health and medical settings, but we operate much more broadly than that. We realised soon as well, in trying to search the literature for appropriate models that were already existing around university community engagement, we just found that there weren't too many, if any, that were a good fit. So we've adopted a systems of innovation approach in describing what that looks like for us. And it also identifies that our small rural approach requires an entirely different approach in this context than typical university-based outreach programs. So rather than the university visiting remote and rural locations and then disappearing again, this is very much about being embedded in the community and bringing them to us, which we've found is quite useful when we're dealing with complex systems and place-based approaches. The question we've most been asked along the way is why Borough? People are often astounded that we're doing these things in a place like Borough, and the answer very quickly became, why not Borough? Once I met Peter, who it's really great to see on screen again, once I met Peter Begren, his philosophy very much about GMC was, you know, there's often this narrative around rural disadvantage that Johanna was describing earlier, but that this perceived disadvantage is actually our advantage in developing place-based solutions that are fit for purpose to suit our needs and scalable for elsewhere, which I just found really useful to shift my thinking when it comes to the narrative that we're often told about. Next slide, please. So some of the challenges we've faced many, and again, I'll try and race through these fairly quickly. Emergence, it doesn't take very much, it doesn't require very many resources for these things to emerge in small places. You really only need one or two entrepreneurial actors for these things to start bubbling away. It doesn't take a lot of resources in the early days, but how to sustain these over time is the million-dollar question, I guess. And that will look different in each place as well. The various focus on the research and development components, which to focus on when and why. And again, the cases we've been looking at, each does these things differently, focuses on different aspects, and again, needs to be fit for place. And the idea of not just building capacity, I guess, but what are the legacies that we'd like to leave beyond the life of the venture? So our communities are working with us. They've invested heavily through their time and in-kind support and hosting students and researchers. They've contributed and shaped our research in partnership with us. So what are the legacies that we're leaving for their contributions, and how can they access beyond the life of our ventures? Next slide, please. Again, I've probably touched on some of these. The one I really would like to emphasise in the interest of trying to keep to time is this idea of universities as followers and not leaders. I think if there's one big lesson that we learned through our experience in a university-led approach, is this idea of if the university is the leader, you will always be at their behest and vulnerable to their shifting priorities, and it makes it really challenging, even more so, to be involved in long-term planning, have any degree of certainty. So I think trying to find that sweet spot between partnering with universities and other institutions is critical. It's a component, but how do we maintain at least some sort of sense of independence, but also secure adequate resources to do the things that we need to do? Next slide, please. And that's probably the end. These last two photos, the one on the left, Peter might recognise as well. As part of our program, we also allow adequate social time, which I know sounds a little bit flippant. Probably it's not serious research, but it provides these really great windows of opportunity for collaborations and proposals to organically emerge. And that's been a really critical part of our programs that we've offered as well. And the photo on the right is a photo taken outside our office premises when we had our shop front with some of our visiting researchers. And that's one of our favourite barbecue spots. So I invite you all to join us at your earliest convenience. Thank you. Tack.
That's lovely. Thank you so much, Heidi, for sharing these perspectives. I do feel really bad that you didn't have time to go through your conclusions, which of course are important. So maybe you could just take them now, because we do have a couple of more minutes. I think it's interesting also to know what would you say are your main sort of results or successes so far when you've worked with this a couple of years? Have you been able to increase the interest among students, for example, to work in rural medicine, or and the capacity issue as well? Have you come closer to any progress there? Or what would you say? Will it take even more time to build the capacity here?
That's such a great question. Thanks, Åsa. I think it's difficult, and we didn't set out to attribute what we do with influencing in a quantifiable, concrete way that we've changed the course or the trajectory of people's career choices. What we have found is that many of the students that we've hosted over the years still continue to keep in touch. A number of them continue to willingly collaborate on papers, joint co-authoring, and occasionally get in touch to see what we're up to, and if they can come back and visit, which I find really interesting. That's not necessarily something I'd expected. I think from the interest point of view, the thing that I've found really interesting, and I think it relates to visibility, in that we're pretty visible locally for the most part. People know if we're here or not here, and want to know when we're bringing the next batch of Swedes and Canadians over. When are the visitors coming? They always want to know. This was obviously pre-COVID, unfortunately. So that visibility locally was relatively easy. Global visibility was also relatively easy. We've never really had to try very hard to encourage people to come and visit us as part of these programs. And the visiting scholars have told us on a number of occasions that they want to be involved with this because of where it is. If this were to be hosted in a large city or a large setting, they're just not interested because they can do that anywhere. What we have found challenging is being visible within our own institutions. So the distant university bases, it's been really difficult to, I guess, focus on building a profile within our own organisations. And that in part has also left us fairly vulnerable a number of times as well. So I'm not sure if that really answers your question.
You're not part of the regular healthcare system in your region, so to speak. But how does that work? So you're not providing specific healthcare services. You're focusing entirely on research. Is that how we interpret it then?
Yes, so we were hosted through rural clinical schools. There's a number of these across Australia, and medical students are hosted through them to undertake rural placements, but they tend to happen in other locations and they weren't happening in our location. So rather than setting out to create slightly unrealistic, unattainable goals for us, we felt that hosting research placements might be one way that we could still offer space for students to come and stay with us and learn from us and collaborate with us as co-researchers in a slightly different way, and they can get their clinical training elsewhere. So that's the approach that we've taken, but it has extended across a number of disciplines, not just health.
Right, I think we have many more questions and we'll come back to you also in the discussion. I also think it's interesting to hear if you've also developed any specific digital solutions or applied digital solutions in your community there with lots of distances. Thank you again, and stay with us. And while we travel all the way up north to Iceland, and Halldór Gudmundsson, are you with us, Halldór?
Yes, I hope so. Yeah.
Wonderful. You're associate professor in social work at the University of Iceland, and you're in Akureyri, as far as I understand. So happy to have you here today. Yeah, please, your comments on this report, and give us a little bit of the Icelandic context to this issue of providing healthcare in your sparsely populated areas.
Yes, thank you, Åsa. I will try to do that. I'm, as you say, working at the university now, but I was a part of the development of the health cluster that is mentioned in the report. So it has been a hobby over the years to work with the welfare technology and so on. But regarding the report, I want to start by just thanking you all for inviting me to this conversation. And I also want to congratulate Johanna for delivering this report. It's an important contribution, I think, because we need to develop and strengthen the technology and quality of life for people in sparsely populated areas. It's a huge issue, I think, and will probably be even bigger and bigger as the time moves on. I have maybe some questions, but also some comments on the main theme, some of the main themes. I hope, and I want my comments to be reviewed as a possible step to review some of the next step, what will happen and so on. But firstly, I want to say it is very positive to get this report, because it's positive to get a compiled overview of what is happening in the Nordic context. And I see, for example, there are new information like Heidi was presenting and other centers that has been presented in the report. One thing that I reflect on, probably because I myself are living in a sparsely populated area, is that it's about the transmission of values in the text. We talk a lot about weaknesses and the problems in this area, but I think it would be interesting to look at the report in strengthening the discussion about opportunities and strengths, and why we see it as an important factor in society that these areas are populated in general. Just to stress that, why is it so important that we focus on those areas? I also I think we could address in a little bit of stronger emphasis that the important part of digital technology today is not only, it is a factor, as we know, but it gives us great opportunities, especially in sparsely populated areas. The importance of education is lifted out in the discussion, and I think that is a huge factor, giving us the opportunities for distance learning and the cycle of learning, actually. And I think we need to address even more the opportunities of support for people, and how we can draw people, younger people or all ages for that matter, into sparsely populated areas to get education or receive some knowledge or education from those areas. I think also that it's very important to relate knowledge, research, collaboration, and contact and advice to politicians as policymakers into this networking context that we are talking about. But at the same time, I think we also need to address, like I said before, the concept of strength and possibilities in sparsely populated areas. Among those things is, for example, the term social capital or something like that. I think also there might be one of the thoughts that came through my mind when I was reading the report was the importance of addressing or making some comments about whether there is differences in attitudes, expectations, and quality of life in sparsely populated areas and other places. And in a way, maybe that has been done through the interviews or in the preparation of the report, but I want some of the things that came up to my mind when I was reading through it was.
I don't think it has been part of the scope of the study, or it hasn't. But I was curious, have you done anything similar in Iceland? Have you surveyed any of these attitudes in the Icelandic population?
Not especially, no. We have, not that I know of, not especially related to technology and sparsely populated areas, not that I know of, but we know a little bit about the attitude of at least the elder generation about the differences between the areas, and we know in some, for example, regarding loneliness or expectation, yes, we have a little idea about how things have been developing differently in different parts of the country.
probably room for more research there. I'm actually gonna now invite Peter into the discussion as well, but hang in there. Thank you so much, Haldor, for your comments so far, and we'll hear from Peter Berggren in Sweden, and then we discuss all of us for a little bit as well. So very welcome to the program, Peter Berggren. You are medical doctor, so you work every day with rural medicine or providing healthcare in a rural and rather remote area in northern Sweden. So please, what are your thoughts on the development of WIiSPAs? And we know that you also work in a front runner WIiSPA, so to speak. You've worked over 12 years to develop remote medicine and different distance spanning solutions for your population in the region of Västerbotten. But yes, please.
Thanks a lot. Yes, I'm a doctor, and and when I started up here as a GP in 1994, which is quite a long time ago, we actually started our first telemedicine projects. So I have grown into working with technology during my career, actually. We have done some work around what the population thinks about technology, and especially the older population. And what we can see is it's very interesting because it differs a lot between the local the communities and so on. So one community could be very fond of using technology, and the other is negative. So, but we have worked mainly with education. We have worked with recruitment, retention, and we have worked with healthcare mostly. But what we have seen, what is also written about in the report, is that it's too narrow because we started with medicine because we saw that the education for young doctors wasn't suited for our needs, for instance. So we needed to make education that made them fit for working with us. Otherwise, it didn't work so well. But we can see the same with teachers. To teach in a small community is a different thing than to teach in a large city. And the education is formed for the large cities. So we have the same problem within the school and within social care, for instance. So the idea, we started talking about what the WIiSPA concept, I think 2015, 16, something like that. And then the idea was that we really need an organization that could actually look upon the whole community, all the needs within the community, the schools, whatever, and also to focus on research in this area, so that we actually have some knowledge about what is necessary to have when you are working in a remote community. And we haven't done so much. We have worked a lot within healthcare research, and we have a lot of work also within social care now, but not so much within teaching and so on. So I very much look forward to this, and I'm glad that Johanna has written about this, because the WIiSPAs, for me, they are larger than medicine. They are larger than social care. So.
Yeah, and that's of course what we try to emphasize as well, the connection between the WIiSPAs and regional development. What have you done to improve the education then of staff to adjust more to the reality where you are?
Yeah, where for instance, we have a subspecialization for doctors becoming GPs. They can be rural GPs, which take them 6 or 12 months longer time. But on the other hand, they will be the best GPs ever. So, and that's made it, we went from 3 or 4, I'm not sure what it's called in English.
Well, specialists maybe.
Yes, becoming specialists in our area to 12, 15 just in a couple of years. So it had a dramatic effect, because before we got those that didn't get anything else, but now we get them that that are aiming very high because they are getting a very good education. So that's one thing. We also have the same for nurses now. I need nurses that could put stitches, that could put a plaster on and do things that nurses don't do in larger cities. And now we have education for nurses to become kind of rural nurses where they call half doctors. So that's very good.
Sounds like a good development path for nurses as well.
And we also have nowadays, with inspiration from both Canada and Australia, we have the medical school in Umeå has puts young students out in remote rural areas now, so they get a lot more time within primary care and within the remote small hospitals, so that we hopefully we can recruit them later on.
Perfect. All right, I think I will now open up for discussion and a few more questions. So if you, dear audience, if you have any specific questions to our speakers here today, please put them in the chat. Otherwise, we have a few other questions prepared that we'd like to discuss with you. But I also think I'll welcome Johanna back and also introduce Bengt Andersson from the Nordic Welfare Center, who is actually the project manager for the larger project where this is one part. And that's a project about development of distance spanning solutions and e-healthcare solutions, specifically for rural and remote areas in the Nordic countries. So anyway, great to see all of you on screen now. Also in general, in terms of what can be achieved, but also some of the main challenges here. We all talked about resources, funding, staffing, etc. Would you like to comment on that, or have you also found ways to solve some of these challenges and focus on the solutions instead? Would you like to focus on that? Who has a comment on this issue? Haldor, please.
Yes, one of the things that I started to think about when I was reading the report was the importance of education, research and development and so on, but also I partly miss the concept of advising or supporting or helping with financing new ideas or implementation projects. I think WIiSPA should be in that, or has been, my experience is that has been very fruitful of receiving support, and that has given us input and support also in actually putting in place some new ideas or services. But
are you talking about national level support, or is it support from your region, or well, you don't have that kind of regions in Iceland, but
we have. Actually, I think the international or Nordic cooperation has been very fruitful, but also I think we need legitimated or legitimate support in the local community plus the national. So it's actually on all levels, I think. But at the same time, I think also that Peter was talking about. It was one of my comments, and you will receive that notes also. That is, I think we need to adjust both education, teachers, social care, and healthcare. One of the biggest issues in my area or my experience has been that we need to integrate these services. We need to stop this silo thinking or practical reality. It's huge important, and it needs to be addressed in a report like this.
Right. Peter, I don't know, did you have a comment on this as well?
No, Haldor is right, I think. So that's very good to raise that, I think. But I think also if you are kind of conceptualizing WIiSPA, that there are something that is WIiSPA. So, and we are putting some standards for a WIiSPA, then you can say to be a WIiSPA, you have a kind of a quality stamp. And that will give us much larger possibilities when it comes to raise funds. And you can also, I can go to my government and say, we are now a WIiSPA, which is a quality stamped organization which are conducting research and development within a remote area that you have probably never heard of. And then there can be, then I think it's easier for me to get some funds, maybe national support even.
So that would be a main contribution also of creating a stronger network between the WIiSPAs, that you could also sort of reinforce each other in these rounds of funding. Heidi, any thoughts from Australia in this regard?
Yes, I think I concur with both comments in that when we started participating more in a network approach, so we started collecting, or I don't know if we were collected by others, we started gathering as some sort of nebulous network, people started taking our activities a lot more seriously. Suddenly to say that we were part of an international bigger network and it wasn't just Dean and Heidi running around town doing some interesting things, I think that really held a lot more weight. And I think also having a multi-institutional approach where you can really value what the community wants as well, rather than an institution saying, here's some resources, but it actually has to be what we want. We're not really so fussed what the community wants. I think that's also really important.
How do you work with surveys? And maybe that's also a question to Bengt. I mean, this question is raised as well here. Are there special needs or other needs in a rural area? And how do you capture these needs? Do you do surveys, etc.? We heard from Iceland that hadn't happened so far, but it sounds like you're really interested in that. And then on the other hand, what kind of solutions have you been able to develop to meet some of these special needs? Who'd like to comment on that? Do you do surveys, Heidi?
Yes is the short answer, not in an online fashion. We actually go out and meet generally face-to-face we'll sort of select a community or two to try and spread the attention, to share the attention and the resourcing. We will connect with a community and go to them and ask what it is that you want. We'll let them know the kinds of skill set that we can access. And that usually then sparks a conversation about what it is that they need, how research might be able to assist in that in some way. And then would they like to join us as partners? So again, it's this idea of we're not coming and doing research to a community, we're working with them and being able to access our international network to do that as well. So we're really clear generally on what it is that our community needs are and how we might be as employees, I guess, able to align that with institutional priorities so that we can get the outcome that we think that they might like or that they've asked for.
Peter, how does that happen in Storuman? How do you develop solutions?
Yeah, it comes out of needs that we have, and we have also had with some of the solutions, for instance, the virtual health room, we have had meetings with the population in the area. So, and that's I think one of the factors that are strong in our area. The people actually believe in healthcare. They think the ambulance will come, and they think the police will come, even if there are almost no police. And that makes it more easy to collaborate with the population. And when we had meetings in very remote areas to talk about virtual health rooms, I think about 70% of the total population came to the meetings. And that's, imagine that in Stockholm. Where would you be?
That would be very crowded, yeah.
That would be very crowded, but then you can have you have it really bottom up then, because you have spoken to most of the population in there, and that won't happen in a big city, and it won't happen, probably not happen outside the Nordic countries either, because the trust is so big here for the governmental institution, much bigger in many other countries in the world, and we should really use that, I think.
Well, it sounds like Heidi is also working with that very bottom-up approach. Haldor, in Iceland, do you do it in a similar way? Do you also meet people to develop solutions together, or in a systematic way, or how is it happening in Iceland?
Yeah, I think we have a mixture of a little bit of everything, like they talk about. But at the moment, it's both institutionalized, I mean, structural innovation and implementation, but it also just a happening. And it is also political views. I mean, it has happened in Iceland that we get suddenly we get a message that we are funded to do something, to buy instruments or technology solutions, but we in a way we actually don't know how to use it because it doesn't fit in the concept of what we are doing. So there are different things that are happening, but I think one of the issues you raised is about surveys and research and so on, and we are participating, for example, Iceland, Norway, Sweden, we are participating in different national surveys that is done repeatedly over series of time. But the difficulties are that for example, Iceland is not a part of all of them. Norway is not a part of all of them. Sweden is not a part of all of them. And we are not able to compare. And the second part is that the participation of people in sparsely populated areas is based on the sparsely populated concept. They are very small. So we need to focus on these areas particularly, I think, in some manner. Just like Peter was saying, if you have a meeting, you get 70% of the population there, and you probably would get that in a research.
Right. I think it'd be interesting to hear actually a comment from Bengt there if you're developing more Nordic knowledge or through surveys, or if anything else is planned within this project of taking these solutions, or the focus on rural and remote medicine and solutions.
Yes, we are continuing with our integrated health and care project for another couple of years. And the first thing we're doing that is looking into what we call model regions that we will publish in a report coming up in this autumn. And one of the regions is one small municipality close to Akureyri, Fjallabygd. And then we look at what ecosystem is in place, looking into what the stakeholders needs, expectations, and what can sort of be delivered. So it will be 5 regions that will be presented and how they work bottom up. Working with co-governance and have the ear to the soil, listen to what the inhabitants in these regions, what the needs are, but also what is available to deliver, so to speak. So that's our contribution here, looking into that.
So more knowledge is coming up. We also have a question here, more in general, how do rural areas benefit from the WIiSPAs? If we put it the other way around, now we talked about listening bottom up to what the needs are. What would you say in sort of in a few lines? I mean, this is a big question, obviously, but where do you see your biggest contribution to the rural areas, to the population, but maybe also for their development, so to speak? What can you contribute with by having a good healthcare system in place in your remote areas? Peter, maybe you want to start.
Well, I think we provide 15 highly academic work. We can have work for 15 persons within this area, which is very great in itself, but also
providing jobs. Yes.
Yes, we are providing jobs for academics, which is that there isn't so many. But also, I think people are kind of proud of the work that is performed. Not only that we can use technology for a lot of connections and so on, but they're also proud that we are having the Statsminister and the state minister in Sweden coming up here to see what we are doing. They're proud of that. And also that we have all these students from Australia and Canada, and they are talking English in the shops, and you know that there's something really great happen. And for the schools, we have the young students talking out in the schools, and we have actually, they have made research programs within high school in Storuman, so the students can connect to GMC to perform quite nice research studies within their schooling. So it spreads not only within healthcare, but it gives the whole community a kind of, I think they are kind
innovation
of
boost, or you
yeah,
really
and an innovation boost. Yeah, that was a good word actually.
Interesting. Heidi, how do you see that you contribute to your area's local development?
In similar ways to what Peter described on a smaller scale. At one point, I think we worked out we might have been something like the second largest employer in town. Again, remembering these are quite small numbers, but we really were proud of that when that happened. Again, the visibility locally when we're meeting with communities, we're undertaking research, there's the economic benefits, but also I think for me, one of the most powerful and probably unintended consequences is knowing that we can do things really well and of high quality in places like ours, and that is an opportunity. And that's not something that we were ever led to believe was a possibility 10 years ago. So for me to be doing my PhD from here, that started because I went to work for a crazy professor who arrived in town and wanted to try this slightly zany experiment, just is huge, and people see that, like Peter just described, people see that it's a possibility. There are ways they can actively be engaged, and they learn how to work with universities, what to ask for, the processes involved, just the benefits are huge, even if it's not on a huge economic benefit. There's still that aspect, but the social the social capital aspects, I think, are something that's been really hugely undervalued, that we're only just starting to understand ourselves.
Maybe need more research into this particular aspect as well to see what it brings extra. Thank you. I think the final question here was how the academic research has influenced for the WIiSPA activity, and I think you all touched upon that already. That you worked hard to change or adjust the academic practice or the academic content as well in the teaching of doctors and nurses, for example, to adjust more to rural medicine, etc. I don't know if Haldor, if you wanted to have, I see that we're also running out of time, unfortunately, but Haldor, maybe a comment if you had one on the, well, either how you see that you influence the rural area or the academic, how the academic world is influenced by WIiSPAs.
I think I go for the influence by WIiSPAs. I think we need to take the words that we were talking about, the proudness and the trust, that we need to gain trust in the sparsely populated areas. And to do that, we need preliminary support and actions from national governments to make the sparsely populated areas stronger.
So building trust, and this is a mutual benefit then. With better WIiSPAs and better services, you can also strengthen trust, and then that can be some kind of, hopefully, a virtuous circle. I think those were interesting and good last final words before I now give the floor again back to Bengt for a final
I keep it short.
comment
Yes.
on the next steps in this project.
Yes. First of all, I want to thank you, Johanna, for a great work, this very important report you have presented, defining and mapping the WIiSPAs we have presented here today. As Haldor said, we have extremely challenges in these areas, of course, but there are so much potential in these areas as well. I mean, we are dependent. The suburban areas are dependent on the sparsely populated areas. We need regional development, and without regional development, it won't work. And healthcare and welfare sector is important to have this regional development. So, I mean, it's a very important area we're into here. If we're going to reach the goal of the Vision 2030 of the Nordic region to be the most integrated and sustainable region in the world, we need to work on this. And I think the WIiSPAs here is a very important part of reaching that goal for 2030, especially looking into the social sustainability, but also regional development and to be a competitive and green Nordic region. And we will go on with this integrated healthcare and care through distance spanning solutions project that will go on to 2024. And we take together with Nordregio We will look into, for example, how we can establish a network, creating a WIiSPA forum, as Johanna mentioned. So you will hear more from us in this area. We will also look into the strategic level, into ministries and authorities in this area. As you said, Peter and Heidi and Haldor, the financial situation as well is necessary to look into. So we will do what we can on the strategic level, but also working on the regional, local level.
Very good. It sounds promising. And we also know that it's a lot of activity happening also in relation to the green transition now in the north here. So we have lots of development in our remote areas. And yes, services and healthcare services especially will be in great demand in the years to come as well. Thank you so much, dear audience, for participating, and thank you for good questions, and thank you, our speakers, for taking the time and contributing and giving us more examples from your different realities across the Nordics, and especially from down under. Thank you again, Heidi, for taking the time at this more inconvenient time of day for you. So you will hear from us hopefully tomorrow with the recording of today's webinar, slides, presentations, some more links, and then we'll keep in touch as our project evolves together with the Nordic Welfare Center. So last but not least, have a lovely, lovely summer. Hej då, bye bye from Nordregio.
Hej då.
Hej då.